بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. I am Dr. Ahmed Al-Malak, an endodontist consultant and infection control preventionist. I have the pleasure to be with you today in collaboration with the Optident project and also Public Health Authority Wiqaya. And today we are going to discuss and explain in details very important standards, which are the housekeeping in dental centers and also the dental units water lines. So as I mentioned, our session today focuses on two essential areas of dental infection prevention. The first is housekeeping and dental center environment. The second is dental unit water lines. For each standard, I will walk you through the practical steps to show you how the evaluations are conducted and explain how to achieve full compliance and full mark. Before we begin, let's understand how the auditors assess the compliance. There are three main methods. The first one is staff interview, where you are asked a question about a procedure or a knowledge and frequency in infection control, and you have to answer based on the Optident guidelines or the MOH guidelines. The second method is observation, where the auditors watch actual practices in real time. Like the auditor may enter the dental clinic and see the compliance in donning and doffing of PPE or hand hygiene, or they may enter the dental lab to see the compliance of standards in real time. Third method is documentation, where the written logs and records are checked. Like the auditor might ask you about the infection control program or the policies and procedures or whatever the document or checklist. So you have to provide it. Most of the Optident standards are assessed through observation and staff interview. So your daily practice and ability to explain them clearly are very important and essential for scoring full marks. Before we start in our first topic, which is housekeeping and dental center environment, there are key definitions which are very important to know. The first one is surface barrier. It's a physical material that prevents microorganisms, particulates, and fluids from contaminating underlying surfaces and must be replaced between patients. Disinfection, it's a process that destroys pathogenic and non-pathogenic microorganisms except bacteriospores. Used for surfaces that cannot be sterilized. Sterilization, a validated process that completely eliminates or destroys all forms of microbial life, including bacteriospores, typically used for critical instruments that enter sterile tissue or the bloodstream. So you must know all the key definitions to have a deep understanding for the cleaning and disinfection process. Also, one of the key definitions, which is very important, is the cleaning procedure, which is the physical removal of foreign materials such as dust, soil, organic matter, and microorganisms from surfaces, instruments, or environments. It's usually performed using water with detergents or enzymatic products. Now we are going to talk about our first topic, which is housekeeping and dental center environment, which is standard number 10 in the dental infection prevention and control compliance monitoring guide. We have to differentiate between the clinical contact surfaces and the housekeeping surfaces. The clinical contact surfaces are the surfaces commonly touched by the dental assistant and the dentist, like, for example, the light handles, switches, radiograph the equipment. And the other services are the housekeeping services, which are the floors, ceiling, walls, and sinks. The responsibility for cleaning and disinfection for clinical contact services lies on the dental assistant, while for housekeeping services lies on the housekeepers. So you have to make sure to differentiate between the two services. The standard number 10 has many substandards. The first one is the cleaning of clinical contact services. So it's cleaning and disinfection. You must clean and disinfect clinical contact surfaces at the beginning and the end of each shift and between patients if the barriers are not used. These include chair arms, light handles, as I mentioned before. Uh, to score a high score or full mark, you have to perform cleaning and disinfection visibly and with confidence. Explain to the auditor the timing or the contact time for the disinfectant use, the why you select this disinfectant based on what, and make sure that the surfaces are spotless when checked. Method of evaluation. First, the observation method, uh, in which the auditors will observe your cleaning and disinfection technique and may randomly check a surface uh, to evaluate the cleanness of the surface. They may also ask questions like, when do you clean the light handle? The correct answer is at the start and at the end of each shift and between patients, if no barriers are used. So you have to stay calm and answer with confidence and always show knowledge of the process. And you have to go back and read the Optident guidelines, also the MOH Manual of Infection Prevention and Control in Dental Setting. To achieve full mark uh, on this substandard, always clean as required. You have to do cleaning and disinfection as required and as based on the manufacturer instruction and the guidelines. Change barriers between patients. Be ready to explain with confidence what you do and why. And the consistency in practice and confidence in explanation is a key factor in getting the full mark in this substandard. Now we are going to talk about the substandard number 2, which is related to the barriers, the use of barriers or cleaning and disinfection for the clinical contact services. For barriers, you have to focus in the material of the barrier, which is either uh, plastic wraps or bags, sheets, or tubing, and a plastic bag paper. Uh, the most important point that it must be impervious and resistant to cut and moisture. The other evaluation method, which is staff interview, the auditor might ask you that how you will prepare the clinic and provide a safe environment for the next patient. So it's a general question, but the main point is related to the cleaning and disinfection of clinical contact surfaces and the use of barriers. You might go through also that the proper waste control and segregation, also the single-use and reusable instruments. For the single use, you will discard. For reusable, you will spray it with transport gel to prepare it to be sent to the CSSD department. So you have to explain with confidence all those procedures. Mainly for the topic of housekeeping, you have to answer that you have used a new barrier for every patient, discard and replace barriers after each patient. You have to explain and give examples of the acceptable barrier materials. Yeah, you have to mention that the barrier materials used can be plastic wraps, or bag sheets or tubing. You have to explain يعني the accepted examples of barriers. The substandard number three, which is the use of disinfectant according to manufacturer instructions. Uh, all cleaning materials and disinfectants must be used according to the manufacturer instructions. The correct dilution, storage, shelf life, contact time, and the use of PPE during the application. The evaluation method will be observation and staff investigation. The observation method. The auditor will observe the availability of approved MOH accepted disinfectants in all dental areas. Also, he will ask about the dilution procedure. Is it done correct or not? Also, the correct use of cleaning technique, the contact time, and the proper storage and labeling of chemicals. Also, the use of PPE like gloves, masks, and gown during the disinfection procedure. For staff interview, the auditors may ask what disinfectants used and where are they stored. Can you explain the shelf life and how you check the expiry dates? And you have to show the auditor how you'll do cleaning and disinfection procedure. You have to show a proper cleaning and disinfection procedure and technique while wearing the appropriate PPE. The shelf life is the length of time a product such as disinfectant or detergent can be stored before it become uh, unfit for use. So you have to know this definition. To score full mark in this substandard, you have to show that all products are must be in date and MOH approved. As we mentioned before, the MOH provide a list of approved disinfectants that we have to stick to the chemical formula mentioned in the this list. Whatever the brand name you will use doesn't matter, but you have to use the correct and approved chemical formula and according to the area and the usage goal. So the disinfectants used correctly, you have to show the proper dilution and time, contact time, and wearing appropriate PPE. As we mentioned, which is a common question that the auditor will ask you, how you dilute, based on what is the contact time for this disinfectant. Always you start your answer with that this is based on the manufacturer instruction, and you start to explain based on the mentioned instructions from the manufacturer. The staff must demonstrate practical knowledge and confident. The storage areas must be organized and labeled. Now we are going to talk about substandard 4, which is suction tube cleaning and disinfection. The suction lines must be cleaned and disinfected daily and also weekly. We have two different disinfectants used for the evacuation system. The method of evaluation will be either observation or staff interview. The auditor will observe if the suction lines are flushed with disinfectant at the start or at the end of the day for the daily disinfectant. Also, confirm that the staff use the correct dilution and approved product based in the MOH approved disinfectants. For the other method of evaluation, the auditor will do staff interview. Uh, he will ask about the cleaning schedule and products used. He will ask about the process and protective measures done during the cleaning and disinfection procedure. Uh, to get the full mark in this substandard, you have to do the flush for the suction lines daily and weekly. Also, use a high-level disinfectant and correct dilution based on the manufacturer instruction. The staff must describe the process accurately and with confidence. Here you can scan the QR in the left side for the dental setting educational platform. You have a lot of educational material available there. Also, on the right side, you can scan the QR for the UpToDent webpage, which include a lot of resources and tools. So it will give you more details regarding the standards mentioned in this lecture. Thank you for your attention and listening. Now we completed the housekeeping standard. Remember, practice, documentation, and confidence are your key tools. Now, let's move to the standard 11, which is dental unit water lines. This is our second topic, which is dental unit water line. This section will teach you how to manage dental unit water lines effectively. You will learn how to test water, flush lines, and use disinfectants properly to meet MOH standards and score full marks. Now we are going to talk about our second topic, which is a critical standard, the dental unit water lines. The substandard number one, the dental unit water lines, disinfection, the products and protocols. As we mentioned before, the cleaning and disinfection for housekeeping and clinical contact services. You have to follow the manufacturer instructions. Manufacturer instructions must be followed for all materials, disinfectants, detergents, devices. This is a critical point. So, if the manufacturer instructions are not available in the facility or in the area visited by the auditor, You have to check the records and the technique followed by the staff. Is it matching the MOH approved disinfectants, the daily or weekly, based on the instructions for use? For the evaluation method, first the auditor will start with the document review. If the manufacturer instructions are available, he will check the records of regular water lines maintenance, disinfection schedule and checklist, match between protocol use and the manufacturer manual, evidence that disinfection matches the frequency and material in the manual. All the checklists needed, you can find it in the Optident platform or website. You can find a very helpful tools. It can guide you for and make it easy for you to apply many standards. If the manufacturer instructions are not available, the auditor will check the records or checklist of daily and weekly disinfection, also the SDS of MOH approved solution used, also the instruction for use followed strictly or not. The second evaluation method, which is staff interview, the auditor will ask uh, the staff about the awareness, or he will examine the awareness of the staff about the manufacturer disinfection protocol, like the contact time, for example. If the manufacturer instructions are not available, what MOH protocol is followed? Uh, are staff trained on the method and frequency of disinfection? Are they wearing appropriate PPE during this procedure? Are the disinfectants available and used as per the instruction for use? As you see, the manufacturer instructions are very important, and the auditors focus on many substandards in this topic for dental unit water lines. To score full mark in this substandard, you have to ensure that the disinfection protocol is followed and documented. If it's not documented, it is not done. If you are telling verbally that you did the disinfection, or you are doing whatever the procedure, the documentation is the evidence for you to approve that you did the dental unit water lines disinfection, and also the documentation for all the procedures. Whenever possible, you have to document everything. So the staff should show confident and explain what done and why, and keep the manufacturer manual or MOH protocol and the SDS easily accessible. For the SDS or the MSDS, you can ask for help from the FMS in your department or in your facility. Also, it's very easy to get the SDS for any product, either it's disinfectant or detergent or even dental material. You can just put the name, exact name and type of material from the company, and you will search for the SDS in the company website. You will find the SDS. Yeah, the issue, it has to be easily accessible for all staff, in case if you have any exposure to any of the high risk chemicals. Like in dental, we have many chemicals like the calcium hydroxide or whatever the material. How to score full mark in this substandard? You have to know the sampling frequency and process. Ensure tests are done and documented. Respond confidently about how your clinic ensures safe water quality. The substandard number two, the water sampling and quality monitoring requirement to ensure water use for patient care meets the drinking water standard, which is a quantitative, not qualitative test, less than 500 colony forming unit per milliliter. What is the difference between quantitative and qualitative? The quantitative, you have to receive a result with a number like 200, 300 CFU. The accepted level in dental is less than 500 CFU, but the qualitative is either positive or negative, which is not accepted. It's not showing us the degree of contamination of water. So the sampling must be performed at all dental water outlets from the dental chair that you can take from the air water syringe and from the water source in the near to the spit-on. Also, the connectors and tubes for the handpiece and ultrasonic handpiece. We have to collect a water sample, and it must be done aseptically. Regarding the test results, we receive many questions regarding the sampling technique, and there is a provided video. You can go back to it in the IBC KSA YouTube channel. It will help you a lot in practical application for this substandard. Okay, so the frequency is twice per year, and and tested in a microbiology lab. And as I mentioned, it has to be quantitative. Sorry. So the positive and negative results will be rejected and not accepted. The evaluation method for this substandard will be a document review. Record of semi-annual water sampling must be available for each clinic. Confirm the results are reported quantitative and CFU per milliliter, not qualitative. So you have to receive a results with number of CFU. For non-surgical procedures, water must not exceed 500 CFU per milliliter. Reports must be maintained clinic by clinic. If the results are in qualitative terms, return them for proper quantitative reporting. So this is a critical substandard also for the patient safety. And you have to focus on the results. I know some of you they search for many labs that they cannot find the labs that provide the quantitative reports or results. But you will find, you have to search and find. This is very important for patient safety. The second evaluation method is staff interview. The auditor may ask who is responsible for taking water samples. Mainly the responsible person for taking the water sample is the public health inspector or the public health department in your center. But if you don't have a public health department or public health inspector in your center, the infection control can do the sampling for the water lines, or they can hire any trained person from the dental health care personnel. What is the correct sampling technique? The auditor will ask you how you will do it. You can find more details regarding the sampling technique in the manual of infection prevention control from the MOH, also in the OptiDent guidelines. Which outlets are included? As I mentioned before, the handpiece outlet, scaler, the three-way syringe, also from the water source in the spit-on. So you have to take it aseptically and follow the proper technique to avoid contamination of the sample. Also, the auditor may ask about how do you interpret the results and what is the acceptable limit. As we mentioned, for dental, it must be less than 500 coloniform unit per milliliter. There is one important point regarding the CSSD. Also, it's related to the water quality. That you have to have an RO unit or distiller machine to have a distilled water to avoid deposition of the salts. You have to check the TDS, pH, and chlorine for the water source in the CSSD. This is also will reduce the damage or the chances of damage of the autoclaves and will increase the lifetime. You must know some key definitions for staff education. The bacterial count, what does it mean? It means the number of bacteria in a unit of water expressed in colony-forming unit per milliliter. This is for bacteriological test, and as we mentioned, it must be quantitative test. The colony-forming unit, the minimum count of viable bacteria cells in a sample. Biofilm, microbial layer that may regrow quickly without regular treatment. Independent water reservoir system used to enhance water quality and allow disinfection control. Okay, the biofilm, as we know, if you neglect using the water lines treatment and the disinfection, the biofilm will form, which may makes the water line colonized by variable bacteria, and it might affect the patient safety, like the Pseudomonas, especially for surgical procedures. So regular cleaning and disinfection of water line will help in preventing the formation of biofilm. The independent water source, which is a bottle filled by distilled water. It's the dental unit will receive a water from a filled bottle by the dental assistant, not from the main container. It helps in control the water quality better than the water comes from the main container. The cleaning and disinfection for the independent water source must be done once per week. While the main containers, we have to do cleaning every 6 months. So if you have independent water source, There are variable disinfectants available for this special purpose that used for disinfection of the water line. Okay, to score full mark in this substandard, keep up-to-date sampling records and make it ready and easy accessible. Make everything ready as a document. You have to ensure all outlets are covered. You confirm staff and understand water standards and can explain the entire process. Reject and return incomplete or qualitative reports. For the substandard number three, the dental unit water lines monitoring record retention. The water monitoring records for all clinics must be maintained at least 2 years for verification purposes. Okay, the evaluation method will be document review. Records of water quality tests. The auditor will ask about the document and he will observe the records for the past 2 years, and you have to provide at least 4 test results per clinic over 2 years must be provided. Documentation should be stored in infection control department or in dental clinic. If any results exceed 500 chlorine-forming units per milliliter, ensure documentation of corrective action is included in the report. I will mention some examples of correct records, like the test result labeled by clinic name and date, reports from approved labs with CFU per milliliter clearly stated, notes of corrective actions taken when water exceeds safe levels. So to score full mark in this substandard, you have to ensure provide 2 years of water monitoring results and traceable and organize, maintain evidence of any corrective intervention. If the water standards were not met, records should be easily retrievable and during the audit. So documents are very important. The test and the corrective action if you have positive results, the documentation of the clinics, it's very important. So make sure to have all these documents. Okay, the substandard number four, sterile water or saline for surgical irrigation. You must use sterile water or saline for surgical procedures like extraction or periosurgery or endodontic surgery to avoid contamination of the surgical field. For the saline bottle, you have to confirm that the saline solutions are used exclusively for one patient and the leftover solution is discarded after procedure. You have to observe a procedure if possible and verify use of appropriate irrigant. So the use of saline water is critical in surgical clinics. The other evaluation method is the staff interview. The auditor will ask what type of sterile solution is used for oral surgery. So, as we mentioned, sterile saline or sterile water. Uh, is it used for a single patient or multiple? The answer must be is it's for one patient. Why is it important to use sterile irrigant during oral surgical procedure? To prevent cross-infection or of, the contamination of the surgical field and to ensure aseptic technique. Uh, we have to discuss some clarification. Oral surgical procedures include periodontal surgery, apical surgery, biopsy, surgical extraction, implant surgeries. The procedures involving mucopharyngeal flaps or suturing. So, all the previously mentioned procedures are considered as surgical procedure, and you must use sterile water or saline during those procedures. To get full score in this substandard, the staff must use and discard sterile irrigants per patient. Open bottles must not be reused. All staff must be able to explain the rationale for aseptic use during surgical procedure. Now we are going to discuss the substandard number five, which is flushing dental unit water lines. The requirement: devices connected to the dental water system, like handpieces, scalers, syringes, must be flushed. Flushing means when you press the foot control for the dental unit. Uh, in this way, you will have water and air coming through this the water tubing. So the flushing means that you will make the water run from the selected tube. Uh, for the beginning or the start of the day, you have to flush the water tubing for at least 2 minutes. At the beginning of the day, you don't have a connected handpiece, so you will uh, try to make the water running to reduce the contamination by bacteria. Select any tubing from the dental chair and flush it in the spittoon for about 2 minutes to make the water running and reduce the contamination. And between each patient, you have to flush for 20 to 30 seconds after each patient. Uh, uh, this is also a technique used for reducing the chances of contamination. As we are pressing the water, the foot control, you have a pressure, a positive pressure. When you release your legs, you will have a negative pressure. There is a very low chance to have contamination of the water line, but you have to do the flushing to, يعني, if you have any backflow of any microorganism or body fluids or blood, you will flush it. I have to mention there is something used called anti-retraction valve, which prevents this negative pressure. If you have it in your center, it will be a good choice because it will help increase the safety for the patient and reduce the chances of water lines contamination. The method of evaluation for this substandard is observation and staff interview. The observation, the auditor will watch if the staff flush for at least 2 minutes in the morning and 30 seconds or 20 to 30 seconds after each patient. Uh, the auditor will observe if the staff is performing morning flushing without attaching handpieces for the time, as we mentioned, 2 minutes, and let the water lines run freely and purge with air. Also, the auditor will observe do extended flushing after weekends or long clinic closure. Uh, if possible, flushing should be done using a container or high velocity evacuation to reduce aerosol spread. Otherwise, you can do it in the spitter. The other evaluation method for this substandard is staff interview. The auditor will ask about the daily flushing routine and when you will do it and the time if it's at the start of the day if it's at the start of the day and between patients. So this is important question and common question about the water flushing. The auditor will observe if the staff are trained in this protocol as a part of infection control orientation. The flushing is critical, as I mentioned. Patient blood and saliva and microbe can backflow into the dental unit water lines. Also, the inadequate flushing can lead to biofilm buildup. To score full mark in this substandard, you have to show the auditor that the correct flushing technique and it must be timed, consistent, and properly demonstrated. The staff should confidently explain the rationale and technique. Also, clinic must adopt this protocol as a daily standard. And if it's possible, you have to make every single step is documented, which is very important and shows that this center is having a high high standards for patient safety and infection control. The substandard number 6, the municipal water tank maintenance. Uh, the water tank must be cleaned and maintained regularly as per the contract agreement in place with facility maintenance providers. Uh, the method of evaluation will be document and staff interview. Uh, the document, the auditor will ask about a document that shows cleaning and maintenance contract in the infection control department. He has to confirm the contract is valid and current. The frequency of maintenance visits is specified. And also will review cleaning checklists and schedules and any documented evidence that proves work is being done as agreed. So the contract is very important, and any document that approve the cleaning and maintenance uh, of the tank. The other evaluation method is staff interview. The auditor will ask who is responsible for overseeing municipal water tank cleaning. Mainly, the public health is the person who is responsible for that. And how often is the cleaning performed? It's done at least every 6 months, and it has to be documented. Does the practice match the correct terms and documented schedule? Are the infection control staff aware of the process and evidence? So those are common questions asked to the dental healthcare personnel during the auditing. You have to be familiar with the water quality and water tank maintenance technique. To score full mark in this substandard, ensure all documentation is available and up to date. Staff must be able to explain the maintenance frequency and method. There should be no gaps between scheduled visits and recorded cleaning. For substandard number 7, water reservoir separation and filter maintenance. So dental clinic or the dental unit has two options or two pathways for water source. either the main container or main tank, municipal tank, or from independent water source. As we mentioned before, the independent water source provide a better control and less cross-infection and easier cleaning and disinfection procedure than the dental unit that receive water from uh, from containers or from municipal tank. The dental unit water system must not be connected to municipal water supply. Use a separate water reservoir and change filters as per manufacturer's instructions to prevent microbial contamination. Also, the filters are very important. You have to make a schedule for the filters to be changed, and it's based on the manufacturer instruction and recommended time for changing them. For the evaluation method, the auditor will use the document review, staff interview, and also observation. For the document review, the auditor will review water filter change logs or maintenance records based on the manufacturer and confirm filter replacement follows the manufacturer's specified frequency. Ensure all filters are functional and not overdue for change. Clogged filters can reduce water quality and safety, so they must be changed as soon as possible. The other evaluation method, which is the staff interview, the auditor will ask the dental staff, what is the source of water in your clinic? Is your clinic using a separate reservoir system? So you have to differentiate, as I mentioned, independent water source, also it's named separate reservoir or independent reservoir, which is a bottle filled by distilled water, filled by the dental assistant, and it must be cleaned and disinfected with a special disinfectant once per week, while the municipal tank or container from 3 to 6 months. So you have to focus on the difference between them. Do staff understand the importance of preventing public water use in treatment? Uh, so you can focus on the common question on this topic. For the observation method, the auditor will confirm that the water supply to dental units is separate from municipal water. Observe if filter systems are present and properly maintained and clean. So the observation will show the auditor the type of, like if he enter one of the clinics and he will find a bottle that he use as a source of water, and he asks the dental assistant what is the type of the water source in your dental clinic, and she did not answer. You have to know that it's a very simple, and you just to be familiar with what is going on in your clinic, the water is coming from where, and how to do the disinfection and the frequency. Okay, so he will observe all this, and he will observe the filters and the logs, or the schedules of filter changing. Uh, The key points for staff awareness: do not use public water for dental procedures. As we mentioned, it's more liable to be contaminated. Also, it's not recommended for hand washing or rinsing. Separate reservoir should be used with chemical treatment or filtration. Failure to replace filters on time may compromise water safety and audit results. So the water quality is a big topic, and you have to focus on the water treatment, the source of water, the filtration system used in the dental clinic. You have to provide. You have a filter inside the clinic. This is changed where the manufacturer instruction. Not all the clinics are the dental chairs are the same. Some they are changed after 3 months. Some companies change the filter, recommend to change the filter every 6 months. Some of the companies every 1 month. This is the job of the biomedical engineer, and that the other filters, which is outside the dental chair. This is the responsibility of the public health department and the FMS. They have to check and change the filter when recommended, or if it's not functioning properly. To score full mark in this substandard, you have to maintain accurate filter change documentation, use a separate treated water source or independent water source, ensure staff can explain the rationale and frequency for filter change. Uh, Now we are going to talk about substandard number 8, which is the maintenance and filter replacement in dental units, which is the extension of the previous substandard. The dental unit filters must be changed and maintained regularly as per manufacturer instruction, and proper disinfection of dental water lines should be performed to maintain water quality for patients. The same as discussed before. The evaluation method is by document review, documented evidence of filter replacement, verify filters are changed according to the manufacturer frequency, confirm that dental unit water line disinfection records are maintained per clinic. Filters must not be reused beyond their lifespan, as blockage or contamination can occur. Uh, so as I told you, three major points in the dental unit water lines: the filtration system, the water source, the disinfection. Also, you can add flushing and the frequency of flushing. Okay, for the contaminated filters considered as critical and may lead to water contamination and interfere with the suction system. If filters are not properly maintained, they increase the risk of infection. Therefore, proper microfiltration and consistent water treatment using chemicals are essential for safeguarding patient health. The use of inline microfiltration is a good choice. Sometimes they call it nanofiltration, which is will purify the water before it reaches the dental water lines or the dental instruments. Always place filters as close to the point of use as possible to maximize their effectiveness. The bore size matters. Uh, a range between 10 to zero point zero 0.03 micrometers is ideal for effective microbiological filtration. For optimal results, combine filtration with regular dental unit water line treatment using chemicals to reduce the biofilm and formation and ensure consistently safe water quality. To get a high score in this substandard, maintain updated record of filter replacement, ensure filters are installed and used according to the manufacturer specifications. Treat dental unit water line on a regular basis and keep documented evidence of treatment activities for each clinic. Finally, follow a combined approach. As I mentioned, the filtering and chemical treatment and logging to deliver high quality and safe water to your dental unit. Now we are going to talk about substandard number 9, which is flushing water lines and handpieces between patients. The dental professionals must flush water lines and handpieces between patients to reduce microbial contamination and ensure water safety. The evaluation method will be staff interview and observation. The flushing, we have two indications. The first one is between each patient for 20 to 30 seconds using the handpiece used. We do the flushing in the spit-on. The other indication is at the beginning of the week, or the start of the week, for about 2 minutes, or after long vacations, you have to do the flushing for long time, at least for 2 minutes. For staff interview, auditors will ask how many times do you flush the dental unit water lines during the day? The correct answer between each patient, and the time is from 20 to 30 seconds. It's done in the spit on, and at the start of the day you will do it for 2 minutes. Uh, for the observation, the auditor will observe post procedure whether the dental assistant do flushing or not. The proper flushing help ensure infection prevention compliance. To score full mark in this substandard, always flush between every patient for 20 to 30 seconds and at the start of the day for 2 minutes. You have to show a confident and good response to the question of the auditor. You have to ensure that the practice is visible and consistent. Uh, this is the flushing of dental unit water lines, and it's simple, but it's at the same time it's if neglected is a risky incident. You can scan this QR to get a deeper understanding of a practical compliance of dental unit water line treatment from the IBC KSA YouTube channel. There is a detailed video about many points in the dental unit water line quality and management. Also, you can scan the QR on the left. You will find dental setting educational platform, which include many resources that can help you in deep understanding of the dental unit water line quality and also the housekeeping. Also in the right side, you can scan the QR for the up-to-date web page. You will find many tools and references and resources that can help you in education of your staff and also for getting all the references needed in the dental unit water lines or housekeeping or any other standard. I recommend you to scan the QR and get more details for the dental unit water lines. Thank you for your attention and listening. And remember to protect your patients by ensuring your water is clean, monitored, and compliant. So clean water means a safe care for your patient. Thank you so much.